are the reliable sources of pain? The very first one.
The patient.
Patient, no? Patient, that's it. Patient, and then vital signs, remember? What are physiologic effects of vital signs?
Elevated blood pressure, rapid heart rate.
Raise in temperature.
Everything is increased, no? Except for temperature. Except for temperature. Okay? Okay? And then it depends again. Remember, there's a difference between acute and chronic. Right? So in acute, you have your physiologic changes, like increase in blood pressure, pulse, and respiration. Okay? Chronic, no more increase. Okay? That's it. It's not increased. It's like because remember the fight or flight, that's why it's increasing, right? Your body is in stress because of that pain. And remember, what's the effect of our fight or flight? Remember that we talked about? Any question with reliable source of pain? Okay. So before you think of vital signs, before you think of visual observation, okay, you want to ask the patient first. Okay. Patient is the most reliable source of pain.
Ms. Joyce, so what was the answer to number 1?
Nothing. We're just reviewing.
Okay, thanks.
So I am telling Giselle, I'm just saying that before you look at your objective, you first ask the subjective. Which subjective is coming from the patient, the subject, no? Giselle, my dear? Okay, so that's number 1. And then if there's if the second patient cannot verbalize, then there you go with your objective signs, no? Okay, so always look at the subjective data first, which is coming from the client. Okay, but I also want you to know the physiologic findings, which is your objectives, right? Anything you can measure, feel, see, hear, taste, right? Okay? All right. Is it clear? Please stop me if it's not clear, no? Review API of pain. So what can you say about this, API? What is API? What is API?
The nursing
Your
process.
assessment, plan, intervention, and evaluation.
Okay, so Nurse Linda, I'm in pain. So you want to assess me first, right? You want to assess me before you go to your PRN medications. Okay, so always follow those nursing process, right? That's a nursing process. API, AD-OPI is the same. Okay, so you want to ask me first. Remember the rate, right? Rate, location. Those are the kind of things, most especially the rate, no? Okay. Because the rate will tell you what to give to the patient. Remember, if it's 1 to 6, it's mild to moderate, right? 1 to 3 is mild. Maybe I can just have Tylenol, no? Maybe I can just have Motrin. Okay, so 4 to 6 is moderate. It says in the book, right? I can still have non-opioids, or I can also have opioids. So it depends what the patient tells you and what's your assessment. Does she need only Tylenol? Does she need, or I requested Tylenol, I requested Norco. Okay, so just remember, nursing process. You don't just give your patient the medication. You assess first, correct? It's the same as data collection on pain. data collection is you're gonna ask more about the pain. When you say more about the pain, what is that? What is that? Are you just
What
gonna
do
ask?
you do that causes the pain?
Yeah. Okay. Those Hilda. Hilda. Where's my book? Let's go back to Hilda. Or the PQRST. Remember the PQRST? Hilda, how does your pain feel? In page 595. Okay. So that is data collection of pain. Okay. Intensity. Intensity is the rate, no? From 0 to 10. What is your pain? Oh. Location. Okay. Duration. 595 guys in your Cooper. And aggravating or alleviating. What makes the pain better? What makes the pain worse? Oh, I rest and the pain goes away. Oh, I've been resting for 2 hours and still hurts. Yeah, you have to go to the doctor if that's the ano. Okay. How do you, number 4, guys? What about this exercise recommended for chronic back pain?
Yoga is one of them.
Okay, yoga, because it takes your mind off of it's like you're healing. What else?
Acupuncture.
Acupuncture,
I did
Yes.
chiropractic.
chiropractor.
Chiropractor, I don't know how you pronounce it, but it's really good. It really removes pain from your back.
Why guys do you say swimming? What is this swimming?
It can alleviate your weight off of your back and your lumbar region, so you can be able to exercise it without causing
Because
any
your
more
core
damage.
put too much stress on your body.
Okay, you are strengthening the core. Guys, when you are strong in the core, you can alleviate also those muscle aches. Okay? So if you will think swimming, stretching, because you are moving everything there, no? With swimming, okay? You're strengthening your core muscles, okay? Guys, please know your rationale why you're doing it, okay? Rationale, okay? You'll need it in your NCLEX and in your exit. Any question with number 4? So anything that can strengthen your core muscles and doesn't put, like what you said, guys, no, doesn't put stress on your back. Okay? So swimming is one because you're underwater, so there's no weight, there's no stress. You're exercising. At the same time, you are strengthening your core muscles. Okay? Proper body mechanics. So, who can tell me how, please define when you're lifting or picking up objects. Tell me how is your body mechanics?
You want to, one, have your feet apart, bend with your legs and your knees, bring the item close to your center of gravity to your body, and then you want to use mostly all your leg muscles to lift up the object. And then also when you're maneuvering or turning, you also want to use your feet and pivot and turn your body into that direction where you're going to go.
Okay. Everybody got that? Wider base of support, bend on your knees and hips, never on your back. Carry it as close to your body as possible. Okay. When you move a patient, you make sure that you are facing the client. no? So you don't have to twist your back, okay? You don't twist your back. You will hurt your back. Okay? Face the direction of movement. Okay? So you don't twist your back. Please remember those, no? So use your large muscles, right? Use your large muscles. 12 and 21 years. Bend your knees. Okay. Everything is in the chat. Don't use back muscles, correct? Actually, ano no, you have to contract your abdominals. Every time they said, contract your abdominals, no? And use your large muscles like your quadriceps, no? Your quads, your legs, no? To distribute the weight. Sylvia?
I have a question, Miss Joyce. I
Mhm.
think this question came before, and I'm confused because there's like two answers. One says, keep your feet together, bend down and grab the product. And the other one said, just bend down and hold the product with you, close to you. It's like two different answers. So which would be the right answer for this? Because it seems like I keep getting it wrong.
Why
it-
there?
Yeah, I saw the two answers though. One is keep feet together, and the other one says pick up the item and keep it close to your chest.
Well, you have to, just remember this, Sylvia.
Uh-huh.
You bend on your knees and hips, not on your back. Okay, to pick up anything. You don't stoop like in your back, no? Then you carry the box as close to your body as possible. You don't carry this like this, right? Putting a stress. I
Sylvia,
think your choices are incomplete.
yeah, the one that you said where keep your feet together. Just
Uh-huh.
think about it. Try it yourself. Try to
Mm.
keep your feet together and bend forward to pick something up. It's a lot harder than if you spread your feet a little bit, widen your stance, and then you try to do it.
So that
gives
was
you-
the right answer. Because
that gives you-
I keep answering that one, that you keep the product to your chest.
Yeah, sometimes try and do it yourself. Even if you're taking the test in Proctorio, they see you anyway. So if they see you act it out a little bit, it's okay.
Okay, I got it.
Mhm.
Thanks.
Okay. Okay. Proper ba? Okay. Picking up objects. Pharmacologic. You know this meditation, guided imagery. Okay. So what is meditation?
Anti-inflammatories like Tylenol, ibuprofen, hydrocodone, acetaminophen.
No, meditation.
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 Oh, meditation. I thought you said medication.
I know it sounds the same.
No, no, yeah, meditation is just basically using your thoughts and trying to distract yourself from where the pain's located to like kind of alleviate the pain. So you're not thinking, your body's not focusing on where that pain is.
Okay, so meditation is, focus, awareness to quiet the mind. Okay, meditation. Guided imagery. Besides James, can I hear somebody else? It's always James. Somebody?
Is meditation the same as imagery?
Guided imagery.
Like
Can I
maybe
ask a question, please?
some people would love to have maybe the cross under their pillow. Some people would like to have maybe an item under their bed while they are sick. They feel it will take the pain away.
The thing of it here is this meditation, all of this meditation, guided imagery, art therapy is all distraction. You are trying, who is this? Lillian, can I just I'll call you later, my dear.
Sure.
It is just taking your mind off the pain. Okay? All of this. Okay? Distraction. Okay? So guided imagery is the use of audio tape. Tweet, tweet, tweet. Like a false, that mind body, no? Mind body. Heal yourself. Lilian. Lilian?
I was mute. Sorry. I was about to say, so non-pharmacologic. So in the Cooper, for the biofeedback, it mentioned it's a pharmacologic. So is it the same or is different?
No. These are all non-pharmacologic. Number 6. These are all non-pharmacologic. Which I know Americans are already trying this, no? Of course, in combination with their medication, no? They combine it. At least they won't have to take too much of the medication, and because they're already getting help with this non-pharmacologic. Isn't it, guys? Right? We resort now to, Americans resort now to this non-pharmacologic approach.
Thank you.
Okay?
Thank you.
Yay. Welcome. Okay, so guided imagery is the use of audio tape. Audio tape, no? Art therapy. What is this art therapy? Catherine.
Just painting, drawing.
Yes, okay, very good. Self-expression, no? Self-expression, self-awareness. Okay? Again, it's distracting, no? Biofeedback. Hector. Because I see you in my screen, Hector.
Sorry, Miss, what was the question?
What is that, biofeedback?
Biofeedback. Let me look at the study guide that I did. I'm not sure, Miss.
It's okay. Who can Kaylee. Kaylee, my dear. Biofeedback.
The book says.
What did you get?
Monitoring equipment is used to measure vital signs and muscle tension. The messages are sent back to the individual. These responses are conveyed to the patient through auditory, visual, physical, or physiological signs, or a combination of them.
Yeah, physiological. Okay, this is in my notes, no? Biofeedback uses an electronic monitoring device, okay, electronic monitoring device, to facilitate learned self-control of physiological responses.
Those
Okay.
patches, Miss Joyce, they put on your back to stimulate the muscle. Is that what it is?
No. Oh, I'm not sure if I think this is patches, no, electronic monitoring device to facilitate learned self-control. So you're trying to control your physiological responses. Yeah. Wow.
I gotta Google that to find out exactly what it is.
Ay, it's in chapter 20, non-pharmacological, no? So acupressure is Ernie. Haley said it's in 584, Sylvia. Ernie, what is
Would that be like heat and cold therapy?
Acupressure.
Oh.
Acupressure.
Is it
acupressure where you place pressure onto the nerve endings or to the affected area of the nerve?
Okay, you put pressure on the, we have these pressure points, no? Right? In our body, like this is not correct. No, I just like, oh, you know, you massage this if it hurts here, right? Those are pressure, acupressure. Acupuncture is, Linda? Acupuncture is what?
Acupuncture is the one that they use a certain needle, the Eastern if people use certain needle to a certain point and they took it inside and the pain is gone. That is what
Okay.
I know they do.
Yes, correct. So the use of needles, no? The use of needles for acupuncture. So there's no small needles, yes. Sterile needles, no? Aromatherapy is
it like diffusers? Like you
Yeah.
can use the diffuser?
yeah. Okay, aromatherapy. Those smells, no? Pain relief, decrease inflammation, relax muscles, promote sleep. They have those, no? Okay. Enhance immune system. Aromatherapy is the smell. Okay. It also enhances immune system, you know. Enhances immune system. By the use of essential oils or plants. Okay. Wow. Lavender for sleep and such. Yeah. So it's not only for pain and sleep, no. It can also increase your immune system, okay, by the use of the essential oils. Okay. PCA, let's talk about PCA. What is this PCA?
Patient control analgesia.
Humidifiers are to, for moisture. Yeah. I'm sorry, go ahead. Who was speaking earlier? Spoking. Huh? PCA, what is PCA?
Is it a drug delivery system that allows the patient to self-administer analgesics whenever needed?
Okay, so patient-controlled analgesia. So when you say PCA, patient-controlled anesthesia, only the patient can control that. Okay? You shouldn't be controlling it. All right? So what about what else can you say about PCA?
It's most effective because the patient has control rather than the nurse.
Okay. Yes.
Wait,
Because
I have a question. What is that? Joyce? Patient control analgesic. What is exactly? Sorry.
No, it's okay. It's a machine. It is delivered. Your opioids are delivered via the machine. If you turn your page to page, trivia page 600. 600.
600.
Okay. Drug delivery system called PCA allows patients to self-administer analgesic whenever needed. Okay. PCA device is portable, computerized pump with a chamber. Okay. So these are set. It's a doctor's order and the RN will set this up. Okay. It depends. It says here, each dose may be as low as 1 ml or 1 milligram of morphine every 6 to 12 minutes. Okay, so it depends on the doctor's order. Even though I press it, if the order is every 6 or 12 minutes, if I press it in 10 minutes and it's not yet due, I won't get any. Okay.
Okay.
So the best thing you can do for the patient is to teach the patient to what? What?
Use it.
Because the patient is already controlling it. So what you want to reinforce teaching with the patient? Like I'm your patient.
The time?
Okay, I know the time. So how about my pain? What you gonna say about my pain?
Do it when you feel pain. Only when you
Yeah,
feel pain.
to stay on top of my pain. Remember, you will tell me use it before you're in too much pain. Yes, because it can cause setback. Okay, stay on top of your pain. Press it when you need it. Okay, don't wait until the pain will be too much. Okay, so what are the common medications for PCA?
Morphine.
Morphine, hydromorphone, fentanyl. What are the two common complications?
Respiration decretion.
Constipation.
Constipation.
Okay, constipation and
Respiratory depression.
respiratory depression. Okay, good job. Okay. Okay. So this PCA, guys, are you sure it's effective? How can you make sure it's effective? It's fast, but it is
When
effective.
how you can know it's effective when the pain of the patient, he said it reduces by so amount of the medication given, then the pain is reduced and it's effective.
Okay. My rate of pain. Okay. Good job. So if I'm the patient, I'm gonna tell my nurse if I need more. Okay, if I need more, because she won't know until I. Okay, so this one again is your data collection of pain. No, there's a lot of data collection of pain in your test. Okay, so please be wise. No, do not get distracted. Okay, so what else? Most common complication, what to monitor. Okay, we already answered that. Anticipatory grief. What is this anticipatory grief?
For the condition that has not yet happened, maybe someone that is going to have the breast operation, I don't know what it's called, and she's already grieving that she's not going to have one of her breasts, she's not going to look attractive, and she's sad. That is like example of anticipatory grief. Am I right?
Yeah. So you already know you're gonna be losing something, or you know your disease is getting it's a progressive disease. So that is an anticipatory grief. Or let's say I have a breast cancer and I'm gonna have a mastectomy soon. That is anticipatory grief. I have it, I still have it, but you know, I'm already grieving because I know grief before the actual loss. That's it, right? I already know I'm gonna lose my left breast. So I'm already grieving. Okay, that is anticipatory grief. So in your test, let's see what's that anticipatory grief. What to monitor when applying heat? What do you want to monitor when applying heat?
The temperature, the redness.
Temperature, redness. What does it mean if there's redness?
Too hot. It's
Vessels dilated.
burning. Yeah, burning. So when you apply, guys, after 5 minutes in the book, check it. Okay, check it. And you always have to put a towel in between that heating pad and the skin. Always put a towel. Do not put those heating pad directly to the skin. Or you're gonna ask your patient to lie on it. No. Okay. Common causes of interrupted sleep.
Pain.
Headache.
Pain, yes. Pain. So, what else? There's two. Actually, there's two. Pain, discomfort. What else?
Noise.
noise, illness, right? Illness, right? So if I'm lying down, how can you modify my pain? Do you want to check in my bed sheet? What? Remember, it's not only pain, the discomfort too.
I
So
would
if
check
I'm
for wetness, maybe there is something that maybe the sheet is wet or the sheet is not. Yeah.
Very good, no? Because remember, guys, it's not all about pain. If I'm uncomfortable, that is also interrupting my pain, my sleep, no? So how to modify my perception of pain? Remember I told you when I was in pain, everything I feel uncomfortable. Any little bit of wrinkled sheets, any tubes that maybe I'm lying on. No, you want to check those. Okay? Wet linens, what else? Reposition me in bed is one. Okay? That's how you modify my perception of pain. Okay? Maybe I'm in pain because of this uncomfortable feeling. Okay, I'm lying on my tubes. Okay, I have a wet pads. Okay? So if you try all those still, maybe you want to offer some pain medication. Okay? What else? Illness, pain,
Stress.
stress. Okay. Sleep apnea and obesity. What is this? Oh, you already know this. You already know this, right? You already know the sleep apnea and obesity, right? Okay. Discuss helpful sleep habits. Okay, there we go. How would you discuss to me how I can help
Have yourself a set
myself?
sleep schedule.
That's okay.
Turn off the TV.
Turn off TV, environmental noise, no? Flushing of toilet, anything that can interrupt my sleep. Doing my dressing change, you know, do everything, guys, when I'm still awake. Giving my medicine, doing my dressing change, anything. Emptying my Foley catheter. Because all of those things that you do might not put me to sleep or might wake me up, right? Have a routine. Okay, very good. Okay, put them in the restroom before they sleep. What else?
Dimming the lights.
Dim the lights, very good. Okay. How about fluids? Can I have fluids before bed?
Not close time you're going to bed.
2 hours before.
Okay, ATI doesn't say totally no fluids before sleep because if warm milk can help me to sleep, you have to give me that warm milk, no, but not too much, like large amount of fluids, okay?
That should be done 30 minutes before, right? The hot milk.
Does it say 30 minutes before?
I thought I read that.
Okay. How about alcohol?
No alcohol, no caffeine.
At least how many hours? 4. 4 hours before no nicotine, no alcohol, no caffeine, no? Because it interrupts the sleep. Okay?
Choice. I drink coffee to go to sleep. Without coffee, I cannot fall asleep. So I guess everybody's body is different, no?
Yeah. Yes, yes, it is. But ATI said no. That's
Okay.
you. Yes, no, but you're right, no. Everybody's different.
Yeah.
And we all know coffee is diuretic, right? Makes you pee. Makes you go number 1. So it will keep you awake just to go to the restroom. What else, guys? So remember alcohol, guys, it can help you put to sleep, but it won't make you keep asleep. Okay? What else? One more? Routine? What else is here? How about naps?
Yeah, you can. Patients can have naps at least for half hour.
Okay.
Nap should be taken not in the evening, close to bedtime, because it's gonna disrupt your sleep.
Okay. So television, no. Anything environmental stimuli at bedtime is a no-no. Music, how about music? What did they say about
I said
music?
no music.
No music.
No music, because it will keep you awake. Okay? So the obese, you can advise them to lose weight. How about recommended hours of sleep? Young adult or adults? 7 to 9. Okay, very good. 7 to 9, no? 7 to 9. Actually, 7 to 8, according to ATI. 7 to 8. 7 to 8. Hospital environment. Oh, this one. We already know, right? No TV, radio, nothing of those that can awaken me. Flushing toilets, changing my pads, or emptying my Foley catheter. Sleep and alcohol. I already answered this, no? Do you have any question with alcohol? Sleep and alcohol.
No question about sleep and alcohol, but all I understand from your statement last time is that you don't take alcohol to sleep because it will make you go to the bathroom to pee, and it will disrupt your sleep. You said so, teacher.
It says on my note, excessive alcohol amounts can affect sleep patterns. Yeah, because it's diuretic, no? 4 hours is okay, right? 4 hours before sleep. Can I get out of bed when I can't sleep? You remember that? Suppresses your RA. Oh, yeah.
So what will be
So
the
that's
right?
why you are. I'm sorry. Go ahead, my dear.
I'm so sorry. What would be the right answer for sleep and alcohol? Just not to drink alcohol?
Large amounts, no. No. And then it says also in the ATI, no alcohol 4 hours before sleep.
Oh, okay, thanks.
So it's not totally no, but 4 hours before, but no large amounts because it's a diuretic, no?
Thank you,
Yeah,
Miss.
you're welcome. That's why it's hard to stay asleep. Yeah, because you are, you're sleeping lightly. you don't have. Rapid eye movement is the deep sleep, no? Yeah. Unless you're blacked out. Yeah.
Miss Joyce, you
Showing
a
your
nurse, right?
face. Yeah,
I said you are a nurse, right?
I am.
Okay, so what is that? So that's something personal, right? I was driving and I got super sleepy. I was with my daughter. I had to pull up. I bought her a little yogurt in the meantime, or smoothie, I remember. And I said, Melanie, just drink that. And I parked my car and I fall asleep for like an hour. I just couldn't move. Why is that all about? I mean, that was weird.
It's just a sleep paralysis.
It never happened to me before, but I got super sleepy and I couldn't make it home. I just pull up, park in the area with McDonald's was there, and I locked my doors and I went to sleep.
Well, that's a good idea, no? When you're sleepy, you have to get out of the road and sleep because you might have an accident. Yeah. That's normal. Maybe you really need some sleep that time, no? Your body is asking for it. So, yeah.
That was crazy.
Yeah. That's a good decision that you made. You pull out of the road, no? Okay. Recommended number, okay, wait. Hospital. Tympanic temperature procedure and rationale.
For adults or for children?
You have to know both.
For adults, you pull the envelope here back. You pull it up and back.
Okay.
Adults. Children, you pull the envelope down and back.
Okay, very good. So you have to know both. Know why. That what is your rationale? Why you're doing that?
Because of the anatomical growth of the body of adult and children. The adults have grown. The anatomical system of the canal is different from that of a child. I read in the book.
Okay. To straighten the ear canal. Okay. That's your rationale. Thank you, Linda. Thank you, James. To straighten the ear canal for both, okay, adult and children. You already know children is 3 years and below, right? Okay. How about the oral consideration, oral temperature nursing consideration?
Ask if they've drank anything hot or cold.
Okay, because it will affect you're gonna have your, I don't know, false results. Okay, not even hot or cold drinks. If after I smoke, you have to wait, no? That's why they let you wait before they check you in the clinic. Cardiogenic shock and pulse. What do you expect? What do you expect? What's your pulse when you're going? What is cardiogenic shock anyway?
When you're shocked, your pulse will rise.
Isn't it when your heart starts to quiver? And
when
AFib?
you hit your nail on maybe the car smash your nail, your fingernail, and then you are shocked, and then your pulse will go high. That's my own explanation.
Cardio is heart, right?
It's like heart suddenly can pump enough blood to meet your body needs.
Okay. So what do you expect your pulse will be? What do you think?
Narrow pulse pressure and then increase heart rate.
Increase heart rate, no? Increase heart rate. Okay. So what is increased heart rate? What's your normal range with your pulse? How would you know if it's your patient is having tachycardia or bradycardia?
So it has to be 12
It is tachycardia and less than 60 bradycardia.
Oh,
Tachy is fast when it's breathing too fast, and when it's slow, it's brady.
You have to know the numbers. So it's gonna give you numbers, right? You're gonna count the pulse. So how would you say it's fast? How would you say it's slow?
100 is fast.
Okay.
less
And
than 60 is
90.
bradycardia.
Below 90, 96 is bradycardia.
okay, use this, guys, no? 6200, right? So anything less than 60 is Brady, right? Anything more than 100 is Taki. Okay? Linda,
Yes, ma'am.
you got it, my dear?
Yeah,
Brady,
anything
Brady
less
means
than 60 is Brady, and anything more than 100 is Taki, right?
yes.
Don't forget also, some people, they may have normally low pulse rate, or they may have abnormally fast pulse rate, but they can be perfectly healthy too.
Okay. Taki fast. Okay. So guys, because we're testing for vital signs, can you please know your normal ranges? Okay. Normal ranges. So temperature is what?
Temperature
90
is 12 to
what? 98.6 temperature. This one is a little bit. 100.1?
100.4.
100.4?
I think that's what it was.
Okay. How about respiration? You have to know in this exam, you have to know. Okay, 12 to 20. And then your pulse is 6200. Okay. Okay. You have to know the normal range to recognize what is abnormal, right? Okay, next.
You said pulse is 60 to 100?
Yes. And BP, it depends on the age. But BP, guys, if you want to turn on, that's the vital sign.
Ms. Joyce,
Let's review the BP. Huh?
the oxygen saturation would be 95 to 100.
That is expected, but there's acceptable, right?
And 91% is acceptable.
Yeah, okay, good. So let's review the BP while we're at it. BP in ATI. What do you have? 135. Normal 120 over 80. Okay? Normal is 120 over 80. So there you go. If you know your normal ranges, oh, James put it there. Thank you, James. If you know your normal ranges, then you can also tell your abnormal. Okay, can you please memorize those? Apical pulse nursing consideration. What is that?
Oh my God.
Why, oh my God.
I off myself from, I don't know how to go back to Zoom.
You're still here.
What?
So what is that apical pulse nursing consideration? When are you prompted to count my pulse for a minute? More accurate pulse, yes. It's the most accurate pulse because that is the actual beating of our heart, right? So what? When do you count my...
The consideration for a for the nurses to use an apical pulse is when you're unable to get a correct counting of the pulse, either from like the radial pulse or the brachial pulse or any other pulse points, when it's not as accurate.
Mhm. Okay. What else, guys? What are, okay, you want to make sure, you want to get the actual beating of the heart. What else, guys? There's two, remember?
Miss Joyce, please, which question are you discussing now?
When do you take my pulse, apical pulse, for a full minute? Baseline, certain
When it's
medication.
not accurate, when the reading maybe it's not accurate and it's not sure, then we don't take it for half the time. We now take it full minutes.
Yes, okay. If it's irregular because maybe I'm taking medications, right? Cardiac medications, or what's the other one? Cardiovascular medications, or I have heart conditions, no? You don't just take my pulse, my radial pulse. You want to check my apical pulse, okay? Pulse oximeter measurement and location. What are the locations, possible locations that you can apply your oximeter?
On the thumb, on the finger to check.
Bridge of your nose.
Fingers, huh?
Tip
The
of
earlobes.
nose.
Earlobes.
Earlobes.
The bridge of your nose.
Bridge of the nose, okay. Toes, right? Toes.
Yeah.
ATI said we cannot use the skin fold because it doesn't have enough capillaries to read our O2 sat. Okay? So be careful with your questions, huh? Okay? It might distract you with something. Okay? Read the questions very carefully, okay? PP is used while taking vital signs. Okay, guys. It's gonna give you isolation precaution again. Okay? Like, if I have a droplet precaution and you're taking my vital signs, what are you, PPEs are you gonna wear? What main PPEs are you gonna wear? Droplet.
Mask.
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 Okay, ha? Remember, mask. If it's droplet or airborne, main PPE, mask. How about contact?
Gloves.
Labs. Guys, don't confuse yourself. Main. Now, sometimes ATI will distract you about if the patient have a wound. Of course, that is already contact. Are you treating the wound for you to use your gown, face shield, goggles?
Face shield.
Are you treating the wound? Why do you use face shield? Because of the splashing, right? Okay, you're gonna get it wrong. If you're overthinking it, just remember what are the main PPEs. If you're not gonna deal with the wounds, mask is okay. I mean, gloves is okay with the contact. Droplet airborne, mask. Okay? Keep it simple, guys. Don't overthink. Okay, we have what else? Apical anatomical landmark. What is that?
The location, right? The fifth intercostal mid-clavicular on the left.
Okay. Left mid-clavicular, fifth intercostal space. Okay.
What?
Left
What was that?
mid-clavicular, fifth intercostal space. What is hypothalamus?
Ma, you said left mid.
I'll put it in the chat. Hypothalamus regulates
Temperature.
body temperature. Okay? As a part of the brain, our brain. How about the MO? Medulla oblongata. How about the medulla oblongata, guys?
Regulates the pain.
Yeah.
Respiration, guys. Respiration. It controls the rhythm of respiration. Okay? How about BP? How are you gonna teach your patient? If you're discharging me, you have to teach me how to take my BP or my spouse or my daughter.
I will tell you to sit on a comfortable chair with your leg on the floor, and you don't have to eat immediately. And you put your hand in the level of your chest. Then
Yes.
okay, and you put the cup of whatever the size that is fitting to the patient, and where the arrow is, you let it point down to the, and then you press it like that, and then you get the whatever reading, you record it.
Okay, good job. So get the correct right size of cuff. It has to be fitted snugly around the arm, right? My arm above the, not above, at the level of my heart, my arm level of my heart. Check the gauge, no? Check the gauge if it is reading, starts at 0, right? Where is that arrow pointing to? You remember that your cuff? It has an arrow where it should be pointing to.
It's pointing to the
artery.
To the
brachial artery, huh? Okay,
artery.
center of the cuff should be pointing in the brachial artery. Okay. How about if you wrap the cuff too loosely?
It won't give you the correct measurement.
Okay. Okay. Do you take my blood pressure after mealtime?
No, I have to wait, I think 30 to 1 hour.
Okay, yeah, you have to wait. So you don't take my blood pressure after mealtime, okay? You're gonna have a high blood pressure reading, okay? Do you deflate the cup too slowly?
No, you deflate fast.
Not too fast, not too slow, okay? Okay. What else? Use a cup that is appropriate size for the client. That's it. No. Oh, where is this? Here. No, what are the hard sounds? Battery and assault. What's the difference? So not when you have to pee. Yeah. when you feel like you're peeing. What is this ano? Battery and assault. Battery is physical harm, okay? When you touch, no? Or I'm already refusing what you want, what the medication you want to try to give me, and you still give it anyway, like a shot, no? That is battery. And assault is a threat, right? You don't let me know you feel like peeing, I'm gonna put your pads. That's an assault. Okay? Physical assault is battery.
So battery is physical assault.
Uh-huh.
Battery is physical assault.
And
Then what is battery?
battery is physical assault. Assault is threat. It's a threat.
Okay.
Oh, one student said to the teacher, I am gonna F you up. Yeah. That's a true to life, no? A student told a teacher, not me. And not in this program, but just a teacher is telling us. That's an assault, right?
Very, very much.
Yeah. It's a threat. And that's a bad, no? Bad, ano.
What happened to the student?
Nothing, because I don't know, a write-up. He shouldn't be saying those kind of things. Yeah. I didn't really ask. If I see her, I'm gonna ask. But yeah, that's the teacher. Is the one that's telling me. That's the one that had an assault. Okay. We already know physiologic effects of pain, right? Any question with that? Everything is increased except the temperature. Heart sounds. What is S1 and S2? S1 is what sound? The lab is S1 and the dub is S2. So what is that?
The lub is the AV valves closing.
Okay.
And then the S2 is the semilunar valves closing.
Everybody heard that? S1 is atrioventricular valve. AV valve is closing. And S2 is your semilunar valve, which is your pulmonic and aortic valve, no? Right? No respirations and how to establish baseline. So respiration, we already know the normal range. When do you count your respiration?
After you take the pulse, you make sure the client doesn't notice that
Okay.
you start taking the pulse.
Yes.
Question what, please, ma'am?
When do you count your respirations?
When the client is not aware of it, when you are counting the pulse, then you are counting the respiration so that you cannot control it and you can get a proper breathing. When it goes up and down, that is one. Up and down, that is two.
Okay. So right after counting the pulse, okay, either you put the arm across his chest so you can feel the rise and fall of the chest. Actually, you're already counting that, right? Or you can just, you don't have to say, oh, I'm gonna count your respiration. Just look at the fall and rise and fall of the chest, okay? Looks like you're still assessing the pulse, right? Okay. Normal values, TPR, BP, and no different ranges of pain. So guys, let me give you this. If you got a high blood pressure, 140/94, but I deny a history of hypertension, what do you want to suspect? Because I fractured my femur.
I will suspect is the pain that caused everything to rise in the body at that moment.
Yes, because of my pain. Remember, everything is increased. So guys, your vital signs and your pain goes hand in hand when it's acute pain, no? Okay? Remember guys, na isa case scenario. Types of body temperature. What are the two kinds of body temperature? I know, Ernesto, I didn't mention about the fracture. That's why. But when I mentioned the fracture, I know you know. This is about the pain, right?
Is it oral, oral, temperature, and I
There's
cannot
two,
see.
there's two.
Rectal temperature?
There's two kinds of body temperature. Core
Ah.
and surface. Thank you. Core and surface temperature. Okay. So
What did
core
you call
is
it?
your core.
Okay.
Core is your rectal and your temporal, right? Those that is not easily
Amma, did you call it core temperature and oral
surface.
temperature?
Core and surface temperature.
Okay, core and surface.
Okay. So your surface temperature is your skin, no? It's easily what's the word? Influenced by the weather. If it's too hot, your skin will be hot also. Oral, if I just drink cold water, is also, you're gonna have a false reading, right? Temporal, skin, yeah. Temporal is considered as, according to ATI, right? Temporal is considered core because it's close to the brain. That's what the explanation is. Stethoscope earpiece position. Where do you position? How do you position your earpiece? Pointing where?
Pointing into the air loop, into the air and canal. Half inch? No, 1 inch.
Towards what? Towards your nose, okay? Or towards the face, towards nose. It's like this because you are following the anatomical position of your ear canal. So towards your face or your nose, okay? What is pulse deficit?
Pulse deficit is the minus or plus when you take it and what is the balance is 4, that is the 4 is the deficit.
The difference between radial and apical, right? Okay, difference between radial and apical. So guys, no, these questions are all case scenarios. If you don't know this basic concept, you cannot. That's why it's only with 35 numbers, no? Because
Radial,
you have to know all this to answer questions. Okay, like for example, 130 beats per minute is what? What do you call that? 125 beats per minute. What do you call that?
Hypertension?
Tachycardia.
Tachycardia.
Tachycardia, not hypertension, tachycardia, okay? Okay, be careful, ha? Read the questions very carefully, okay? Always ask the patient to determine the rate of pain, where is the pain, okay? What else? Teach the patient to stay on top of his pain and let you know if the medication is not helping, okay?
That is for PCA.
It's everything about pain, I'm telling you. Okay? What else? Remember those physiologic effects of pain? Everything is increased. The two that are common that interrupts the sleep is pain and illness, right? Okay, pain and illness. For you to help me to modify my pain, check, do your nursing intervention first. Check if there's, am I lying on something? Am I, bed are wrinkled? Bed sheet is wrinkled. What else? My bed sheet is wet. Anything that will make me feel uncomfortable, please help me with that because you're gonna help me with my pain also. Okay. What else? What is the best pulse that you can use as an emergency, in an emergency assessment? Carotid. How would you assess it? Like this?
No, you don't kill the person. You just put
No,
two
with two fingers.
only by the side.
Okay,
Like
one side only. You know, guys, carotid artery is the artery that supplies blood in our head. So you don't do the Arnold Schwarzenegger thing like this. You've seen it in the movies, right? One at a time, okay? Because you are occluding my circulation to my head. Carotid artery supplies blood to our head. When do you count apical pulse for a minute if I'm taking medication, heart medication, or I have a heart condition, right? What is hypertension, no? Please know if 120/80 is normal, what is stage 1? What is stage 2? Okay. That's it, no? Do you have any questions?
Ms. Joyce, what chapters does this cover? 12 and 21 or 12 through 21?
12 and 21.
Okay, thank you.
You're welcome. So in this test, it's gonna give you your normal vital signs. So you have to know the normal to answer this question, no? What do you need to report? So you're gonna look at the abnormal. Okay? I think that's it, no? That's the whole exam.
Can you please answer?
Excuse me, Ms. Joyce. Are we to log to the Zoom tomorrow morning first, or we go exam first?
No, you have to clock in and then do your test and come back at 9 o'clock.
It's just like the last exam we took this morning. I don't know if you see my score or I have to post it by text message.
I see your score here. I
Okay.
have it at 100%. Thank you, guys. What else? That's it, no? Everything is here.
Miss Jimenez, can you please answer question, like 33 question, please?
33, wait. What is the systemic?
No.
What is the systemic effect of cold?
Shivering.
How would you know that, huh?
Shivering.
Shivering. If I shiver, you know it's getting systemic, okay? How about the systemic effect of heat?
Sweating.
No, that's a normal effect of
redness.
Test.
Remember heat is vasodilator. Cold is vasoconstrictor. So if I'm vasodilated, what happens to my blood pressure?
Oh, blood pressure
Up, down,
down.
down. Because if I have this blood pressure, the blood vessel this big, so right, I can have my hypotension and dizziness. No, dizziness.
So dilation is hypotension?
No, if it's dilated, the vessels are dilated, pressure is down.
Yeah, because there's no pressure if my blood vessels are huge, no, or the oh my gosh, what is this? Diameter is getting
Like
bigger. There's no
to,
pressure, right?
to my understanding, Miss Joyce, is that when it's constrict, it's cold, and when it's dilated, it's hot.
Yeah,
Is that
that's right.
okay?
That's right.
Okay. Okay. Thank you, ma'am.
So okay,
Thank you, Carla. Thank you,
sleep.
everybody. Thank you,
Sleep
Sylvia.
is 7 to 8. Sleep. I can wash. I can wash. I can walk briskly for 30 minutes before bedtime.
No.
I will limit having glass of wine. I cannot have a large amount of fluids, right? I can do my massive relaxation in the afternoon.
Yeah.
Okay. I can get out of bed until I fell asleep. I can get out of bed when I can't sleep. That's okay. I exercise 3 times a week in the morning. Routine, right? Routine. I cannot have 2 glasses of wine every night before bedtime. It interrupts my sleep. That's it, guys. Good luck.
Thank you. Good night.
Yeah, read the questions well, and don't be distracted with, there's a lot of distraction, guys. Guys, this test number 3 is for the students, no? It's a little bit challenging. Yeah, thank you for your time, guys. Because it's a lot of distraction. Answers are close to each other, so please. Yeah.
Thank you, ma'am. Good night. Good night, everybody.
Welcome. Yes. Thank you for your time, guys.
Thank you, Ms. Joyce.
You're welcome.
Thank you.
You're welcome, guys.
Miss Joyce, can I talk to you for a minute?
Of course. Breakout.